Going live today here with Kelvin. So he was going to actually have me go onto his Instagram, but technical difficulties. Maybe it's Instagram not letting me actually get onto his, but I'm going to wait for him to get on here and then suggest for him to start the podcast or flow as if, Kale had me onto his Instagram. So we'll just kind of go with that subset. But I think I just got here. Let me check my calendar though. All right, Kale, you can hear me?
You're too famous for me, man. I can't join. You
Di-
can't join me.
Yeah, dude, I honestly, it might be just from the truth I speak, right? No, I'm kidding. I'm kidding. All right, brother. Well, yeah, well, I'd say, yeah, you still take a hold of it. I know you're on mine, but you keep going with it. Whatever. Your audience still can see it, so we're good.
I got you. I got you.
And you
Well,
know
yeah.
you're
Hey,
live too. You know you're live too.
I got you. But hey,
Yeah.
first of all, thank you for coming on board with me, man. I know you're super busy. I know we talked
Not
about
that
this for a
busy.
long time.
Yeah, dude, man, it's been a year almost, right? It's been a
I,
year almost.
I think so, man. It's been so long. I'm just
Well, it's
like,
like when I met the gang out there, I met Gabe, I met some other people out there. Like, I mean, it's just been up from there.
hell yeah. And like, I've seen you been doing your grind, been on TV. I need to get your autograph now, man. I don't know what to do
TV.
anymore, bro.
I mean, it's that Midwest life. No, I'm kidding. But yeah, we'll get into that. We'll get into that.
Sounds good. Yeah, but so guys, I brought on Diego on board. If you guys don't know who he is, he'll introduce himself in a couple seconds. But I just want to bring on board to kind of shed some light on the industry and also in terms of like health, from gut health, hormones and everything, nutrition intake, whatever the case may be, can help you guys out within whether it's competition prep or even just overall holistic lifestyle, whatever the case is. So without further ado, here's my special guest for the night, for the day. It's going to be Diego. I'll let him introduce himself, what he does, how he started, and everything like that.
Awesome. Well, thank you. Thank you again, Kelvin. But yeah, so Diego here, functional medicine practitioner, health coach. And so I'm based out in Minnesota. So I do a lot of coaching in Minnesota, but I'm really very diverse in the United States, to be honest, country. And what I do, what I practice is functional medicine. So it's more focusing on that root cause issues that many people struggle with in, the conventional realm. And so people come to me when they deal with chronic health conditions like IBS, IBD, hypothyroidism, weight loss resistance, or just obviously just trying to lose weight too. And they want to do it in a more natural approach that sustainably helps them actually do that. So, the short and sweet, so the name of my company is Complete Vitality Functional Health Coaching rather. And yeah, so we do a lot of integrative therapies. We do a lot of functional diagnostic lab testing. So what that even entails and what that actually means is we do testing that actually finds the root cause. And we'll get into that today, going through like the GI issues, gut issues, bloating, constipation. But just think about it as when you see a doctor, you're only seeing them for like 10 minutes max, depending on like what doctor you're seeing, primary care physician, endocrinologist, OBGYN, whomever. And the thing is that short amount of time, you're not able to grasp the whole collection of that individual and like what their specific situation is. And that's when people come to me because they want to feel heard, they want to be seen, and they want to fix that true reason to why they don't feel well and why they're still struggling. So I've been doing this for the past almost 4 years now. So I've been in practice for about 4 years. I don't practice conventional medicine. I don't practice functional medicine. I give suggestions rather. So yeah, that's a big thing. And yeah, it's been great. I mean, tons of success stories, tons of, people all across the country, even United Kingdom, Canada. I mean, I've been able, thank my Lord above to get to that point. So yeah.
That's good, man. Yeah, I'm telling you guys, this guy works magic. Trust me. If you guys
Mhm.
are on prep or even just lifestyle, reach out to Diego. He will help you guys out. He did help one of my good friends, Gabe, um, with especially with his
Yeah.
competition prep. And if it wasn't for Diego, he wouldn't have won the whole show.
Oh, he
So
did win that.
congrats,
Yeah, I
bro.
do remember that.
Yeah,
That was
you won that
tight.
show, man. So
Yeah.
you're a
He
big part
got
of that.
first down there. Yeah. Damn.
Yeah,
Yeah.
because I
Damn. Yeah.
remember when he was sending me his chicken pictures. I'm like, whoa, what's wrong with you, man? Like, why is your gut so big? And he told me he went to like like a little off
Yeah.
the
Yeah. Just like
offside
yeah, just
beach.
just a mild case of SIBO, I'd say dysbiosis rather. But No, I actually forgot to say, like, I started out in the conventional Western medicine field. So I started out working inside the clinics. I worked at a nursing home. I worked in the memory care unit. I was 16 years old at the time, and I was giving out pharmaceutical medication to people, just numbing them. A freaking joke, I'll keep PG-13 here for today, but it's sickening out there. You look at your grandparents, you look at your parents, and you don't want them to go through that route. You don't want them to do that because on the other side of that is it's scary. It's numbing, it's symptom suppression, and it's just not a good world. And so when I saw that firsthand and I saw what that did to people, that's something that like it's hard to unsee, but it's also empowering to see in terms of like, okay, we can do something about this. This can be avoided. You can do things starting today, no matter how old you are. I mean, if you look at statistics now, I mean, 1 in 3 children have prediabetes, bro. Like
Oh
one
yeah.
in three, 1 in 3. That means that every you see 6 children, 6 of them, 2 of them have prediabetes statistically. And so we're not going to it's not getting better. We have more coaches, more healthcare spending, more doctors, more nutritionists, yet we're getting sicker. And this is talking about the industry, but yeah, we'll get into it today.
Let me broaden up that topic real quick. Would you say that's more systemic through socioeconomic kind of like struggles? Would you say that's a big part of that too, though?
I
Especially like
think
higher in the
I
West
I
Coast.
think so here's what my ideology is. There's, not to get too far or whatever, because
Yeah,
for
for
some
sure.
reason in today's time it somehow has gotten, to that point. But I'd say a little bit. I'd say it's education, man. Like education's so empowering, but then again, habits aren't taught, they're taught. Okay. So when you have your parents that are, trying all these different things or doing all these things, then you as a child is gonna watch that, or you're gonna be doing that because you're just like, I don't know any better. That's what my parents are doing. So if your parents are eating pro-inflammatory foods, they're not getting exercise, they're not getting sunlight, they're not taking care of themselves, or they're emotionally and even mentally filling their mind with just things that are just totally negative. Shit, man, that's huge. I mean, that's going
Oh,
to
for
put you
sure.
into a spot that just doesn't even inflame you on a physiological level, but on a psychological level, that then will induce you to hit those quick dopamine hits that you get from the food. And this is a whole different topic with the functional medicine deal, but that's just more of like my opinion. Yes, I also think though, if we want to be realistic here, at the end of the day, if you look at McDonald's back in 2000, and you look at McDonald's back in 1995, yes, their ingredients were a lot better. I'm not gonna lie. That's why when you went and ate there every 2 times a week or whatever, you didn't have prediabetes. You just were fine. So socially economical, I'm not talking about like, maybe we don't have access to the food anymore, because for sure, maybe more healthy food does cost a little bit more. I mean, hell, you're in California, so I can't imagine over there. But I do want to
Crazy, man.
say I think a big thing too is when we talk about socially economic, dude, it's the fucking companies. It's the
Yeah.
food companies. It's the pharmaceutical companies. Now, like I said, I'm not going to get too far into that, but
No, no, for sure.
it's all for profit. Because
Yeah.
if you really think about it statistically, what's happening is that they're they're trying to squeeze so much funds from everything. They're artificially raising cows and cattle so they can, do their thing, so they can put it in a burger, into chicken with eggs, dude. It's absurd. Because I saw something where it's like, dude, we don't even have enough cows for how much burgers McDonald's is even like giving out, for example.
Yeah,
You
I
know
can
what?
imagine that.
Like, dude, like I think it's like 1 million burgers they get a day, worldwide. There ain't a million cattle just sitting out. Like, where's that coming from?
Yeah,
Like, where's that? Where?
it's in the
You,
lab.
I don't know. And so, yeah, I think at the end of the day, it's all for profit because natural healing, the stuff that I do that they call pseudoscience, has been around for hundreds of years. It's only been the early 1900s when they actually founded medicine. Yes, conventional Western medicine, allopathic medicine is life-saving, no doubt. I say it every single day. When you have a gunshot wound, you don't come to me. You go to a surgeon. When you got a cardiac event, you don't come to me. You go to a cardiologist. But
Cardiologist,
when
yeah.
you have a chronic condition, statistically, actually, textbook definition, chronic means 6 months or more. Okay. That means you're dealing with a condition that actually connects more than one system in the body. Now, this will actually unwind to what we're talking about today, but when you're dealing with a chronic condition, chronic fatigue, chronic bloating, chronic constipation, that doesn't mean your gut is a mess. That means that many other hormones and systems in your body are also influenced by those issues. And so that's one thing that I've learned when I study functional medicine, when I studied that, was that we do not look at the body in isolation. We look at it as
In whole.
systemly
Yeah.
whole.
You
Correct.
have to,
Yeah.
because there's a root cause for everything. And to kind of break down more into what you said about, like, you used to work at a medical field and things like that. So I was at the ACE unit in Zuckerberg here in San Francisco. So it's acute care for elderly. So I was
Mhm.
dealing with patients with dementia, delirium, and then also pretty much hospice, right?
Yep.
So I could
It's what I
remember
similar.
to the T. I don't want to, because obviously I signed an NDA, but I just remember doctors were putting band-aids on wounds, basically. Not literally, but
Yeah.
you know what I'm talking about. Just like, oh, intake wise, just
Well,
do this,
dude, so
medicine.
so yeah, NDA too. But how come I looked at the script because I gave out the medication, narcotics, morphine, bro, you name it, benzos. How come every single one is on an SSRI? What is that shit about?
I don't know. They're
Why?
just trying to get funds out there.
How many times I'm sitting there and they're coming to me and they're like, What happened to my mom? What happened to my dad?" And like
Yeah.
they're like, I'm like, I mean, at the time I'm a fucking teenager. I don't know, but I'm just saying. Now I look back and I'm like, dude, they're just numbing them. They're numbing them. And dude, it's a sick world. And I don't want to get
Too much into it.
too animated on it, but
Yeah.
but yeah, for sure, it's that's the work we do. That's the work I do for sure. Is being preventative than reactive. Okay, Western medicine is reactive. We're preventative. We're fixing the issue. We're preventing you from the issue. Because just for statistically, 70 to 90% of heart attacks happen with normal cholesterol levels. You know that normal, fucking
Yeah.
normal. We're talking
Exactly.
about 150, 100 total cholesterol, and yet strokes, healthy individuals. Now, um, we can get into that. I run fractionated lipid panels, dude. I run all the tests. I run so much different things, but yeah, for sure, we can get into that today too.
For sure. Got you. Well, yeah. So, I wanted to dive deep into this because you are also a coach. So, if you guys don't know, Diego's also a lifestyle coach and
Oh
nutrition
yeah,
coach, and
my
you know,
primary is all lifestyle. I mean, yeah,
lifestyle.
because client comes in, yeah, because well, when we get back to the fundamentals, that's the root cause to
Yeah,
many people's issues too. Is sometimes it's not just a poor lifestyle, but there's many influential things that I help with that.
exactly. So, I want to kind of just pick your brain a little bit. So,
Yeah.
let's say someone comes to you, wants to work with you, things like that. How do you address the common issues in terms of intake wise? How do you fix their diet? Like, what's your whole start and like where do you check the boxes out? Like, for me, like, and let's say, for example, for me as a prep coach for competitive bodybuilding, obviously it's a little bit different. But I also do coach the lifestyle aspect as well. So,
Yeah.
how do you start the process with your own work? Because obviously all coaches are different, but since you're more entwined with like nutrition, dietetics, hormones, and gut health,
Yeah.
what's the root or the number one things you look out for before you even start working with an individual?
Yeah, yeah. So the first thing is that we want to look broad spectrum and like, okay, what are we presenting here? And most people are presenting with a plethora of issues. It's not just one. Okay, so what happens is that most people are like, oh, I have a weight issue, so caloric deficit. I got a gut issue, probiotic. I got a low energy issue. All right, just eat more food, take caffeine. You know. So what we're doing here, what I'm doing with my clients, because I'm a one man show at this point. Not soon. We'll get more people, but like we're fixing all the systems abroad. So what that really does mean in like layman's terms is like we're reducing the things that are negatively affecting my symptoms. Common food sensitivities, we're taking those out for majority of clients, patients, however. Excess stress coming from overall caffeine, different types of overtraining. I do that a lot. People coming with overtraining, cutting carbs, under eating being the biggest ones. And then the biggest profound thing we're doing is, I hate to say this live, but we're doing proper detoxification protocols.
Oh, for sure. Yeah.
And no one even understands what that even means. They're thinking about juice bomb, go get
Juicing,
Herbalife tea,
cleansing.
like whatever, whatever.
Yeah.
No, we're actually supporting the body's ability to eliminate and excrete harmful substances that are in your body. We do this by supporting your lymphatic system, your liver, your gut, and the whole plethora of other influential hormones and organ systems that influence that. We stimulate your thyroid function since 60% of the population have underactive thyroid and don't even know it, and 90% of hypothyroidism sufferers are Hashimoto's. We
Mhm.
support adrenal gland dysfunction. Most people come in, they're either dealing with too high of cortisol or too low. Matter of fact, everyone's so depleted and brain fog, they actually got adrenal fatigue, which clinically is not even shown because they'd rather put you on a corticosteroid to get your injuries up. But that's a whole different topic. Another big thing is that we're nutrient deficient because we can't even absorb and assimilate the food that we're eating. So we're improving stomach acid levels because hypochlorhydria is what millions of Americans suffer with. That means you have low stomach acid causing GERD, acid reflux, and heartburn and indigestion. So we're honestly doing this all at first. And we do it by the foundation slash flush. That's what I call it. So when I have a client come in, no matter who you are, you're an 18-year-old looking to get bigger, grow muscle. If you're a 40-year-old dealing with systemic inflammation, joint pain, brain fog, fatigue, perimenopausal symptoms, I don't care. You're doing all of it. Statistically, we're swallowing a cart of plastic a day. The air we breathe, the shit they put into the air is not good for us. Anyway, so we're going to start with that flush. And really, I'll tell you this, people are losing pounds of excess water, excess estrogen, and excess shit, essentially shit. Like, do you know that we have 5 to 7 pounds of just stool in our stomach?
Every
Like
day, yeah,
for
sitting there.
physique outcomes, that's not favorable.
No.
That's not favorable if you're trying to step on stage, you're doing vacuums, and you're trying to, see how well you can get the final two at the bottom. That's not advantageous. So what we're doing is we're doing this. And so what it looks like is that it's more of an elimination type deal for not for everyone. I can't say this is for everyone. Everyone's so different. It's why it's not like a one size fits all, but we're doing more of like an anti-inflammatory eating that is going to help someone with identifying what are the food sensitivities I'm dealing with, what are the food triggers I'm dealing with. And so, with doing so, we're going to also support blood sugar balance. We're going to support thyroid function. We're going to support detoxification. And I can tell you, within days, I am not even exaggerating this. Within days, people are having a 180 in their symptoms. 180. Better sleep on the first night, better energy throughout the day, like just losing weight for like the first time in forever. And they're doing less. They're doing less and we're getting stress down. We're getting nutrients actually to be absorbed so they have more energy for that. And that's typically how we get things going. And now, while all of that stuff's in motion, they're getting their laboratory test done. So what does that mean? When someone comes in, we're going to do this flush foundation, but then we're also going to get the laboratory tests needed for their specific case. And this is where it comes bio-individualized significantly. Because if you have a hypothyroid issue, I'm not going to give you the same lab tests as if you were dealing with chronic gut issues like IBS or IBD or any chronic gut issues. If you have multiple sclerosis, another autoimmune condition, I'm not just going to give you the same tests as I would give for someone who's dealing with infertility or hormonal acne or mood swings and PMS. They're all so different. And so
Mhm.
that's why it actually takes an educated person that understands physiology and understands pathology and understands symptomology, just ology, to actually get a comprehensive approach to someone's issues. So another big thing is where like so many people we also do genetic testing like we just started doing that we started doing genetics testing so now we're testing genes and epigenetics but that's a whole different topic and if you guys want to do that it's going to be a crazy program I'm going to get crazy outcomes I'm getting it done on me right now but yeah so as that flush foundation's happening as you're speaking about your first question it's a long-winded answer but that's kind of what we're going from there yeah
Yeah, and it's really good that you brought up certain topics when it comes to finding out mapping out digestion systems, especially like
yeah
let's say for me, like in a competition prep setting where we're pushing our body to absolute limits, where your body's not meant to be in terms of like homeostasis, homeobalance, just overall, just your body's not meant to be sub 5, 3, 4, and even for women, especially for fat,
yeah well
like
yeah dude I've had so many women come to me post hey, this don't feel bad. Like this is the
Yeah.
nature of it. Like so many other coaches will bash prep coaches, but dude, no, that's the goal. And that means more than just what you see on stage. That means something to
Oh,
you.
dude.
So as someone trying to disempower rather, or say that all these negative things, no, don't do that, dude. Like don't do that. Like why would you do that? It disturbs me because I mean like you don't know what that is for someone. You can't just like blatantly be black and white saying, "Hey, this is good," whatever. But yeah, go ahead. Yeah.
Yeah, no, for sure. And it's really important that you we shed some light on that because a lot of times, especially like with different types of approaches, lifestyle coaching, whether it's weight loss or getting muscle or things like that, in a more extreme setting like competition setting, that's even worse. We're having to fight cortisol inflammation on a daily basis where sometimes when you have to push the body down so much, sometimes you got to pull back too. Like what you said, bringing down inflammation, bringing down food absorption. And that's what a lot of people don't understand when, obviously we're going to the competition side right now, but when a lot of people come up to me and like, oh, I want to do a show, like, oh, I want to try doing a show. I'm like,
Hmm.
okay, let's check everything out. All right, you're young. One, two, you've never been this lean before. Three, your lean body mass is not enough to. I have a
Bring your
certain.
best package rather,
Yeah,
as
not
yeah.
not just that, but the one thing that I always like to focus on is that if someone's coming to me to do a show, whether or not they start from a rough canvas or like an already built canvas, the
Yeah.
biggest thing for me is considering their lean body mass. That's specific. I know
Mm,
I'm gonna go
yeah,
more in
it's
depth of
it's critical.
bodybuilding. So when the more lean body mass you have or skeletal muscle mass, the more your BMR is a little bit higher, or your
Mm,
maintenance macros or numbers,
yeah,
whatever
for
the case
sure.
is.
Yeah.
So when your BMR is higher, that automatically, well, not in all instances, but that's already easier for you to drop that weight
Mm.
because now I don't have to do too much. I just have to
Well, dude, yeah. I'd
manipulate food a
say
little bit.
yeah. Well, dude, it's the opposite for me. Because the lifestyle client has been chronically dieting, yo-yo dieting, that their BMR is like at freaking 1400 when
Yeah.
we want you at like 1800.
Yep.
So that's why we reverse them. I mean, obviously in plain, I mean, I should have said that bodybuilding terms, we fucking reverse diet you.
Yeah.
Like, like, yeah,
Like more food? What?
yeah, like we reverse, I guess, like, yeah, I should have said that, but no, we reverse diet you. I mean, and they're like, holy shit, like, I'm eating so much more food, I'm losing weight. And the thing is, though, is we have the support stuff, and then we're doing proper detoxification protocol, so you don't blow up a propane tank when you're eating, a surplus of 600 calories above TDE, total daily, whatever. So, like, dude, yeah, that's critical because it's the same ideology with you. Because, like, you're not trying to have your athlete at 800 calories on 40 minutes of stair stepper on peak week. Like you don't want that. That's cortisol through the roof. That's just so much water retention. That's not a good package. Same ideology here. I don't want my client to be losing belly fat at 1,200 calories a day. That means I failed. I failed as a coach. I want my women are eating 2,000 calories, dropping 1 to 2 pounds a week, depending on where their body mass is. That's a very healthy response at the caloric intake that female is taking in.
It's a very
And so,
controlled, steady pace.
yes. And that means that if I want, and if she's like, Diego, dude, like I'm cool, I'm good with a little more hunger, or I'm good with a little bit more activity, more output throughout the day, whatever manipulative thing you want to pull and push, then I'm like, good. I can take 200 out. Her response is great. So I love that approach. I mean, that's critical because that's essentially what I do. And so, I mean, some of the other things I do too is that when I do the reverse diet, I like to stimulate thyroid function. Since carbohydrates go up, in a refeed, and thyroid hormone actually plays a huge part this is why everyone on keto has thyroid issues, by the way, and hair loss, which women would know that. It's among those that are suffering from it. But by the way, 1 in 8 women have thyroid issues. Anyway, but so when you increase carbohydrates, thyroid hormone goes up, T3 goes up, and
Mhm.
also cortisol then goes down. It's an inverse relationship. No one understands that. That when you increase carbohydrates, cortisol decreases
Mhm.
because insulin increases. And that's a it honestly is case dependent because there is a catabolic effect that does occur when you are increasing insulin, but for the most part, it does decrease cortisol levels, especially in a body that's homeostasis is off, then for sure, 100%.
Yeah, for sure. And then going more into like the nutrition aspect. I want to dive into, and this is, I think, a lot of people have issues on, and they try to either avoid food or minimize food or things like that.
Yeah.
I wanted to pick your brains about tolerances versus allergies, because this is one aspect that a lot of individuals have a confusion on, where,
Wow,
oh,
that's a great question.
because there's a big difference from intolerance to allergies.
Yeah.
One can kill you, one doesn't have to kill you. You know what I mean?
Yeah,
Like
I
it
love
can.
that.
So I wanted to kind of pick your brain about that because a lot of people are actually
Wow,
don't
you guys,
understand.
if you guys got Kelvin as a coach, dude, like you guys are set. No, I'm not kidding. Actually, that's a good question. Yeah, so I like to split up. There's three of them. There's a food sensitivity, food intolerance, and food allergen.
Mhm.
A food sensitivity and a food allergen are both immunological responses that happen when you eat a food. It means that I eat peanuts, flare up, my immune system, face swollen, puffiness, or hives. I eat a food intolerance, it's a 45-minute or 3-day delay in my symptoms. This is the most I deal with. Food intolerance means I lack the enzymes to digest the food. Can I say it one more time? Food intolerance is I drink the milk, I don't have enough lactase to digest that diarrhea or loose stool. So so when I'm dealing with a client nutritionally, the main thing I do is I actually cut out all intolerances, yes, intolerances, and common food allergens. Because this is a lot better than them spending $1,000 on a food sensitivity test right away. So then during our process together, it's like, okay, week 6, let's reintroduce gluten back in. Let's see how the body is feeling. Let's see how your joints are feeling. Let's see how your brain is functioning. Let's introduce dairy back in. Let's add in some cottage cheese or Greek yogurt. Let's add in some, maybe just some cheese, in a meal. And let's see how your body responds to that. Now, an intolerance, those typically, I mean, from my knowledge, those are more hereditary genetic.
Mhm.
Okay, so you're pretty much born at that at birth. Now, are there things at birth that can influence that? Now, I don't want to get into that, but like vaccines. But what I gotta say is like w- you can. Those are things that you mainly need to stay away from, and so those are typically like, okay, what is it? Eggs, fish, dairy, and there's another one. I can't. Peanuts are being kind of biggest ones, nuts. And so those are, yes, a immediate response immunologically. Now, the food intolerance, the ones I work with the most, I do food intolerance testing. I do something called MRT, food sensitivity testing, that is actually measuring the levels of IgE in the blood, the immune response. This is not like a hair sample food sensitivity test. No, you're going to draw your blood because at the root level, it's your immune system that's reacting to these foods, not not my hair, but that's a whole different thing. So with a food intolerance, a lot of that actually has an underlying reason to why I'm reacting to all these foods, why I have all these immune system issues, histamine issues, mast cell activation syndrome. So what's happening is that my gut lining has become permeable. Now,
Mhm.
this is actually the root cause to many food sensitivities. It's like, coach, I can only eat my chicken and rice and maybe some asparagus. I can't eat anything else because I bloat and I flare up.
Well,
And
yeah.
yeah, yeah, it's because I have a food or I have a leaky gut. Leaky gut. What happens is your gut lining is like this. They're like it's held together by something called zonulin. They're proteins. And what happens is that all this stress from dieting, training, pre-workouts, artificial sweeteners overly done, disrupt this gut lining, and now it becomes permeable, like it splits through. What then happens when it splits through is that in our intestines, food starts to flow out of our digestion system and into our bloodstream. Now, when it goes into our bloodstream, our immune system looks at it and thinks, oh, shoot, that's an invader. Let's attack it. Let's attack it. And then that's the immunological response that occurs from these food sensitivities. And so it does not matter. If someone's 600 pounds and eating McDonald's, Canes, and just, not moving, their gut lining could be as the same disrupted as the 4% body fat bodybuilder.
Hmm.
Artificial sweeteners, no food diversity whatsoever. This is where people don't even understand when it comes to health coaching or coaching in general, is that same person too. They can have the same insulin levels. It's actually pretty profound. And I've done it many times. I've seen it firsthand in clinical experience. So anyway, the reason why
Sorry,
Melty Board are
sorry to cut
dealing,
you off real quick, but
yeah,
I saw research that I was doing my research a long time ago saying that
yeah,
although it's not sugar, artificial sweeteners I can actually still, in fact, stimulate insulin sensitivity
yeah, insulin.
because it still
Well,
mimics it.
and dude, you're gonna love this because you know where it's gonna go. You know where it's about to go. You
Yeah.
know where it's about to go. It's
Yep.
because insulin is mainly found in the gut.
Yep.
What is mainly found in the gut and what motherfuckers are pushing, sticking needles in there? GLP,
Yep.
GLP and GIP.
That's what
Oh
we're gonna
man,
get into after.
you
That's what I
tied
want
it
to
in
bring that
well,
into.
right? Anyway, so yeah. So what happens is that you have artificial sweeteners. You know, I have one right here. I got Balm. This is my favorite. It's low cal. But anyway, yeah, there you go. There you go. I mean, and it's my vice for sure. But anyway, um these artificial sweeteners, aspartame, sucralose, these we ingest these. Our gut does not know the chemical difference between that and sugar.
Yep.
It honestly doesn't because they're honestly similar structures. So then what happens is that yes, our blood sugars do rise a little, but it's not the same where it's residually elevated.
Yeah.
It's more of just an acute response, but then our gut still has to digest it. But
Hmm.
our gut our gut was never made to digest artificial sweeteners. So then what then happens is that actually fully doesn't get dissolved.
Yep.
There's no absorption that's getting occurred because our gut was never made. We don't have the digestive juices and enzymes to actually break down um, uh, artificial sweeteners. We don't. So then, if we continually chronically use this and drink this is why I'm a big proponent of. I like this because it has the choline benefit. It helps brain function. You know that. But black coffee, that's like if you want that caffeine source. But anyway, and so yeah, that will increase and disrupt gut microbiome. And honestly, it causes more cravings too for people. I know when you're dieting down for a show. Um, I can answer that at some point too. So thank you for that, by the way, Martin. I'd say when people are dining for a show, yes, it's good to do whatever you can to suppress appetite. But what I've seen through what I've done is that honestly, when I have clients just budget their caloric intake, well, not it's not a good bias, but if it's just 130 calories, I'm like, dude, just have the real sugar because the real sugar is I tell them to do it pre-training, obviously so they can get
Just
more
burn it
energy.
off.
Yeah, so I do it pre-training, uh and so yeah, that's a big one, but for sure.
I just had to jump on that. I was like, this is such a topic we're gonna talk about later on.
Yeah,
And then food allergies.
yeah, food allergies. Yeah, so with the food allergies, I mean the best thing I'd say is finding the supporting the immune system. So your immune system is made up of Th1 cells, Th2 cells, and then lymphocytes, neutrophils, and just how our body is your immune system is like your number one guard. They're MJ on the 96 Bulls. Like like I learned this from actually a cancer doctor that does natural therapies to improve uh you know whatever cancer. So it's like we want to like make sure that dude is full force. We want our immune system to be as full force as we can. But what happens is that when you are not supporting your immune system, whether it be you don't have actual bacteria diversity, as crazy as it sounds, like the reason why most people get sick now, more children get sick, is because we're so germophobic. I mean, like you remember being a child, we were dirtballs. I mean, but that actually supported our immune system. It
Yeah.
made our immune system more resilient. It made us I mean, well, a vaccine, you're getting injected a virus, and your immune system is now creating cytokines to fight this virus. So then, whenever this viral comes back in our environment again, our immune system
And
is
knows where it
resilient
is. Yeah.
and get rid of it. Exactly. So with the food intolerance, right, food allergen, my bad. It's similarly the same. Our body just doesn't recognize these nuts as it being a safe source yet. So what I've seen a lot is that when I support the gut lining, we go back to that leaky gut and I fix the leaky gut. But not only that, because that's where most practitioners stop. That's where most people stop. When I actually fix leaky gut and I bring back diversity into the gut microbiome, so that means I bring in more prebiotic fibers that should produce short chain fatty acids, or I have someone take a short chain fatty acid like sodium butyrate, and then I also tell them to eat more or I should say, I don't just tell them take sauerkraut or kefir. I have them do actually. Uh, I do tell them to do that at a specific point, but I tell them to take high doses of Lactobacillus bifidobacterium at a high at CFU at a high CFU. We're talking about a few billion, and so I do that though after repairing the gut lining. But even there's a thing before that, and that's what the flush is for. We have to get rid of the dysbiosis in the gut. It's a large, and I actually learned it. It's funny because I was reading it this morning. I bring in the sun. That's why it's so. This doctor here, she's an incredible doctor. She wrote two books, Gut and Physiology Syndrome, and then she wrote Gut and Psychology Syndrome, and it shows like how the gut is actually influenced on the neurochemicals, neurotransmitters, obviously, and then with allergies, hormonal problems, neurological decline, and you have to get these phases corrected. Um, in order to do that, because Hippocrates had said it best, all disease does begin in the gut because your gut is more than just a digestive organ. It influences your hormone function and influences your immune system. So, going back finally to the allergens, 70 to 80% of the immune system is housed in the gut. So, why are we taking immune suppressant drugs for autoimmune conditions? Why are we doing that? Why are we looking at the gut when there's C cases? You know, C19, cancer. Like why are we doing that? It's crazy. It's a crazy world, and it's because it doesn't fix the root cause. What's the root cause to these issues? The immune system. The immune system. It gets overactive. It doesn't recognize these things. We're fighting viral pathogens. So why aren't you supporting that? So when I fix their gut, it indirectly supports their immune system. Therefore, hey, my son is eating nuts again. My son's having peanuts again, peanut butter, like because their allergens are gone because we fixed these underlying factors that influenced the immune system.
That's heavy.
Yeah, for sure. It's taken years to do this, so don't mistake the, whatever talk that you see here today. Like this comes from working in the trenches with many, many people like every day.
Oh,
So that's
thank
that's how I'm able to rattle it off like that.
I may not be as more specific in detail as you, but I deal with it on a daily basis too, and
Yeah,
it's a nightmare at times, you know, and it's kind of those things where you start questioning yourself. You're like, "Oh man, am I do something wrong?" This and
yeah,
that. But I did want to shed some light on something real quick before we move on to the heavy topic, which is like the main
yeah.
reason we're here:
Absolutely love it.
probiotics, preventatives, and also how to mitigate and find things out faster. What are
Mm.
your main things, or what would you say would be precursors before you actually intake certain medications or even some, additives? How would you prevent that? Like, let's say like an average Joe and non-competitive, like what would you recommend to them on a daily basis to change, do, or even like consider,
For like healing the gut or just overall general wellness.
Let's talk about overall in general wellness. Like, what should we like be more proactive on in terms of like preventing these from becoming bigger issues?
Yeah, yeah. So I'd say that the biggest thing for many people is they're nutrient deficient. There, even if you're eating a whole food diet, we are our soil, agricultural things happening in the United States right now as we speak, are so devoid of nutrients as it once was. Today, it will take you to have the equivalency of having 74 cups of spinach would be the same equivalency of having 2 cups of spinach just back in 1980s. Our soil is devoided, and what's happening to America is that we're overfed but undernourished. Overfed, undernourished. So our body is starving for nutrients, bioavailable nutrients that we can take in. What does that even mean, bioavailable? Nutrients that our body's able to absorb. Well, what's happening in our environment? Many people have predepositions of different gene snippets like MTHFR, COMT, that then now through the environment that we have and is going through, it causes something called epigenetic change. Now our genes have turned on to therefore cause these issues like poor methylation. Now, that I shouldn't say this black and white because this is not happening to every single person. And I don't want you to think that. I don't want you to go research, like, do I have this gene or not? No, don't do that, please. Don't
Start
do that.
googling everything.
Don't do that, please. But this is the proof point here. So what's happening is that our environment is so devoid of nutrients that even if we're getting enough food in through a diet, through a whole food diet, we may still be nutrient deficient. Vitamin D3 being one of the biggest, at least where I'm dealing with. I mean, I have a lot of East Coast. I have a lot of Midwest. So Midwest, East Coast, we're further away from the equator. We don't get as much sun every day. And I mean, I guess throughout the year rather. And so that's the biggest one I see through blood work. Now, the second one, dude, that's going to change so many lives is zinc. Zinc. Males get like Males don't get enough zinc because sweat and you know what is made out of zinc. And for females, they don't get enough iron. Enough iron. So I see so many women that have anemia. I see so many women that have zinc deficiencies, and then I see so many on both sides have vitamin D deficiencies. Now, for your audience and people that are in your location, I don't think vitamin D is that much of a concern unless you work an indoor job, and maybe most do. I don't know. But yes, vitamin D severely supports your immune system. And it's actually a hormone as well. Now, the thing is that the reference ranges for these things are off. Like the reference range for like vitamin D is like 30. No. I want my clients at like 60. But so so going back to your first question, like what are some things um so all males should take ZMA is what you're saying. If it's a reputable source, I'd say so. Yeah, before bed, like that's a great one. I like that one. Um yeah, I'd say make sure it's like, magnesium glycinate, bisglycinate, even magnesium L-threonate. But yeah, going back to what you're saying though, like what is something you could do? Like, dude, get more minerals in, get more nutrients in. And yes, like I said, you can get that through food, but figure out the deficiencies. Like if someone is I used to work in a supplement store actually, and I know I didn't want to get into it so much earlier, but I used to work in a supplement store. I ran the supplement store. And I would always put someone that was like, hey, dude, like, I don't know what I'm doing, but I want to feel better. I would put them on a very high quality multivitamin. But obviously, we need to make sure you're getting the fundamentals done. But if you're watching this, hopefully you already have those dialed in. I usually put them on a very high quality multivitamin, usually through Thorne or some source like that. And then I'll put them on vitamin D3 plus K2. And then I'll actually put them on some
For
calcium.
absorption, right?
Yeah, for
Because
absorption. And then I put them on calcium and then I put them on zinc. And that'd be like my tri quad stack. And for them that was a good price point too, and it was a good sell for them because it wasn't that much and it was exactly kind of what most need to just get started. Because dude, remember if you're taking all these natural supplements to increase your testosterone, or if you're physiologically just taking it, it's a whole different story. But you still need these nutrients at the end of the day, no matter what you're doing. So and like so many people I've seen have been dealing with iron deficiencies, even males too, which is crazy. But it happens. And the zinc deficiencies is kind of been the biggest one. Now, the next one I'm gonna say is anything that supports your sleep. So then I also tell them to take magnesium glycinate, which was a good one. So every single client I have come into my program, no matter who you are, is I always start with 400 milligrams of magnesium glycinate or
like
L-threonate, depending on if anxiety is more prevalent in that case or issue. And I always tell them to do it before bed, just because it's GABAergic release that happens before bed. So improving melatonin production, improving the glutamate neurotransmitter. So I always have them start with that as well. So those are kind of be like the top ones because if there's anything to do with your health, the first thing is to improve your sleep and your nutrient status. Everything else is because nutrient status, your mitochondrial health. Because you hear all these like high level functional coaches being like, you got to support your mitochondria. Well, what the hell does that mean, dude? Is it me shoot another peptide? No, no. And don't use that code again. I'm not going to use it. I'm kidding. They want you know what I mean. But no, you got
there
to
you go.
see, like that's the thing though. They want you to start shooting peptides, but they don't even have the fundamentals right. Like, dude, shit's getting scary out there. Bro, getting it. But
Yeah,
like, yeah, that's going to support mitochondria. That's going to support circadian rhythm health. That's going to support hormonal health. That's going to support digestion. You know that your gut lining is made of zinc and glutamine. So this is just you got to get these nutrients in, dude.
just
I'm
baseline at
so
that point.
pro nutrient. Yeah, yeah. Like I mean, for me, I take. I take like a not a multi, but I take like this multi. It's a comprehensive mix of nutrients and minerals. So it's like selenium, iodine. It has other co-minerals in it too, calcium. So yeah. So you just need those, and I've used those for all my cases, and like the tough cases, and they've all had dramatic improvement.
Nice, nice, nice. Yeah. So, are you doing good so far? I know there's a lot of topic just throwing onto you. So,
Dude,
are
I
you
love this. This is good. I'm good till 3:30 my time, so we're solid.
okay? Good.
Yeah, we're
Next
good.
topic is probably going to be the heaviest part of this segment, and I know it's something that everyone's going crazy for right now. But now we're starting to see a lot of negative feedback, side effects, and also lawsuits in case for majority of
Yeah.
these companies. So the biggest one's going to be GLP medications. Okay, so
Mhm.
I'll Ozempic, Retatrutide. I always
Yeah,
mix up,
register. Yeah.
and
Yeah, yeah.
and
So
so many more. So what's your take on
yeah.
it? How do you feel about it? And like when is it the right way to use it, and when the wrong way to use it? How would you diverse into that?
Yeah, so I think it deserves a spot to actually get educated on like what is the pharmacology and the pathology. Now, this is not going to be an endocrinology class, but I think it's important in layman's terms to understand what these medications do in its simplest form and the difference between each and every single one. So right now on the market, even the gray market, the black market, however you want to say it, there's three main GLP agonists, meaning they agonize these hormones that our body naturally makes. There's semaglutide, aka Ozempic. There's trizepatide, aka Manjaro, Zepbound, and there's retatrutide, which there's no name pharmacy brand of it yet. So these are the three primary peptides, or I should say GLPs rather. Now, the first one, semaglutide, aka Ozempic, only influences the peptide hormone GLP. That stands for glucagon-like peptide 1.
Yep.
That hormone influences your leptin levels and your ghrelin levels, and then also slows down gastric emptying. So the release of insulin is slowed down, the digestion of food is slowed down, and then also you get more satiated and you get more satisfied with less food. That
AKA
number,
appetite suppressants.
yep, appetite suppressant for sure. I mean, that will solve, 80% of America's obese crisis. But what happens is that like anything in functional medicine, one thing actually in conventional medicine, one thing they made these drugs because metformin stopped working for diabetics. Anyway, that's a whole different topic.
Yeah, that's a big
And then,
topic.
and then we have the second generation trizepatide, Zepbound Manjaro, which is probably the most. I mean, it's the most common being used right now because Ozempic just got a $2 billion lawsuit, and now trizepatide is stronger. It's better because it also has that second agonist to it, which is the GIP. That's glucagon insulin-tropic polypeptide. Big word. What it pretty much means is that now it works on your insulin levels even more dramatically. So you have all the first effects from the prior peptide that we just spoke about. Now you have a second effect with insulin. In what way? What this hormone then does, or this peptide, is now it helps your body lower insulin faster, faster. So then your body stops using glucose as energy and it actually starts having your liver start using fat cells, rather glucagon, or I should say carbs for or triglycerides as fat for energy, rather than what it was using before, which is glucose, carbohydrates. And so it's for someone who's 600 pounds, man, that's incredible because now your body, now you're not gonna like pass in the best in very nice terms. But the third generation, which is now having a third agonist to it. So it has the GLP-1, it has the GIP, but now it has the glucagon receptor. Now this is where things can get astronomical, where now your body at rest is burning fat. Yes. As I'm sitting here right now, if I was on retatrutide, my caloric intake burned will be probably 2x. Meaning, I'm sitting here, we're talking about basal metabolic rate. My basal metabolic rate is going to be a lot higher. My liver is just going to be pumping glycogen through my body to the
You're
point where it's like,
overworking
oh, we're
basically.
tapping into fat stores now. It wants to tap into, so it artificially helps your body tap into fat stores. And so then what happens is now I can't eat. My insulin levels, I'm hypoglycemic. and my body's just doesn't have it's just I'm fucking shot fatigued because my body just used all its energy because now it wants to start burning fat initially. And so, like any good practitioner that's actually liable, not, I shouldn't say any good practitioner, but someone who's clinically experienced and wants the best for their patients, clients, whatever, athletes, I've taken all of them. I've done all of them. And not because I medically needed it, but because I need to understand where my clients are coming from when on it, because that's appropriate. So I will tell you that taking GLP-1 semaglutide was freaking terrible. I mean, I couldn't eat, but I didn't I it was shot. I was nauseated. I had to take Zofran. So it did not help. I took trizepatide. That was a lot better. That was probably I don't want to say favorite, but that was my best out of the three because it was more of like I was feeling stable. I let a water retention drop. I had a lot of inflammation drop just from like just artificially. It's just gonna happen, And then the red true tide was, oh my goodness, that I'd say there's benefit for sure. For me personally, that really messed me up. I mean, I was uh I mean, my girl was like, "Yo, what's going on with you?" And I was like, "Dude, I was hypoglycemic. I was getting chills.
Were you
I,
lightheaded at times
yeah,
too?
lightheaded. Dude, I couldn't even walk, really. I couldn't even walk, and so it's a scary world out there, And so we did that. So, going on the topic now, like, okay, are these bad? Are these good? Well, what the heck? What's happening in today's time is that telehealth medicine clinics are getting paid a fortune to just give these out like candy. It's Halloween out here. It's fucking Halloween. It's like, oh, you need to lose weight. Oh, boom, let's get you this. They are now going to peptides over hormone therapy, which is like the most obscure thing I've ever heard in my life. But anyway, so do they have their time and place? Absolutely. I've used, and the thing is how you use them. So what's happening though is with most doctors, they're overprescribing them and they're overdosing them.
Yep.
Overdose. The number one, you know what the number third killer in the United States is under cardiovascular disease and cancer is?
Mm.
It's medical malpractice.
Mm.
You know
I can
that?
see that. I can see. I thought that was like one of the first ones to be honest with you.
Yeah, yeah. Well, I mean, heart attacks happen like every
Yeah.
second of the day, and unfortunately, and cancer obviously is horrific event. But third is medical malpractice, which is just its equivalent, and that means that it's someone over prescribing or just yeah, in the name of medicine, they're over prescribing. So what does this even mean? People are taking these medications and they're overprescribed. So now what's going to happen is they lose weight so fast and they get so symptomatic, meaning they deal with so many symptoms to where it just dissipates them. It puts them out. They can't work, they can't function, they can't move. And over time, this destroys your natural production of GLP-1 and GIP. What does that then mean? It means when you get off, you rebound like your first breakup. Like it is so bad. You start getting food noise that you never had before.
It's.
You
I heard
start
it's
getting
worse after.
yeah, and that's what I mean. Like you get food noise you never even had before. You get so dude, you can get your motherfucking self type 1 diabetes. I'm not saying that because that's an autoimmune condition, but you can then get these like weird issues where like now you're just craving insulin. You're craving sugar rather. That's the right way to say it, but you're craving that insulinic response that you get from food. You start, overthinking these things. Biggest one though is you deteriorated your body composition. And this is what all diets do. This is all what fad diets do. You lose more muscle than fat. On the scale, I lost 18 pounds. No, Susie, you didn't lose 18
You lost a
pounds.
lot of
You
muscle.
lost you lost 9 pounds of muscle and you lost 6 pounds of fat. That's what happened. And muscle weighs more than fat, Susie. So guess what? Guess what makes it look better? And so even if you're on prep, even if you're an athlete, I especially in growth season. I mean, that's just out of the equation. That would just be nonsense. But like a lot of that that shit comes mental, you gotta, it's a mental game. Okay, so I was bashing the shit out of peptides and GLPs. Now let's actually talk about the medicinal benefits of it now. So you guys fucking, I don't have any affiliation. I'm not Johnson& and Johnson certified. I'm not Lilly certified. I don't got no. I have a telehealth medicine clinic that does have them, but I actually lose money on doing that. Uh, so anyway, so what's happening here? So I'll use microdoses of GLP-1s on my clients that absolutely need it, or we're dealing with a condition, honestly. So for a lot of my thyroid conditions, specifically Hashimoto's, I will use a microdose. So what is this? Now, obviously, everything spoke about on this podcast is not medical advice. I'm not a licensed physician. This is just for educational purposes only.
These are just
Disclaimer,
two guys talking.
disclaimer. Now, what I would do is I would start out at like half mg rather than 2.5. Because that's a huge, and that's a small, that's the lowest that you can get prescribed. And mainly it's getting prescribed 5 mgs. I'll go half, and I'll see where the body's at. Hey, okay, we're insulin. I'm looking at postprandial blood sugar readings. I'm looking at fasted insulin or blood sugar, and things are improving. Okay, I'm looking at TPO antibodies. And so why is this even happening though? Research is coming out that microdosing these peptides, which are actually the legitimate dose, because think about it. Honestly, these are one of the best medications ever made because they naturally help something. They naturally do something. Most medications, pharmaceuticals, are petroleum based, meaning they're like manufactured in a whatever, and it's like symptomatic. But this isn't. I mean, there is symptomatic if you overdose it, like anything. But when my clients are taking these like micros, through my clinicians, through my telehealth company that I'm partnered with, then they don't deal with those symptoms. They only get the benefit. Because what happens is that their body just gets that natural push, that little tudge that it needs to get the medicinal and get its effect that it needs to occur. Now, are there prerequisites before you even get in that conversation? Oh, tenfold. You come in with a gut issue. Why would we slow down digestion? I had a woman come to me. She's like, "Yeah, I can't lose weight." I looked at her hormones. I looked at her stool test. We did a stool test. I'm like, "Oh yeah, you want to see why I can't lose weight? Look at this. All hormones are flatlined. Cortisol through the roof. T3 and hypo. You got elevated antibodies. Your insulin levels are through the roof. You have no diversity in your gut. You have no acromantia. This is a whole different topic. Talk about the specific probiotic. When we talk about probiotics, we talked about artificial sweeteners. We want to talk about acromantia. And I'm like, yeah, that's why you can't lose weight, and this is why you can't respond to the medication or to the GLP. I've used GLPs, like I said, myself, and my clients have used it through my telehealth medicine clinic. Uh, so what I'd say is it's given great benefit for those who absolutely need it. Um, because what happens is that it just gives the body a little nudge. Now, here's the thing. Everyone loves a quick fix. Everyone loves to just prolong these and abuse them. That is where people get hurt. So when I look at the whole picture of the equation, I think for number one, there's way better ways to lose body fat than suppressing your appetite. I always loved losing body fat, and I always love my clients losing body fat by actually supporting the metabolism. All diets do not support the metabolism. The best diets to support the metabolism have been clinically shown to improve the longevity of the weight loss occurred. What are diets that improve the metabolism? Resistance training, proper nutrition in terms of getting enough protein and getting enough, making sure you're staying your caloric intake, just fucking basic day
The
one
baseline
stuff.
thing,
The
sleep. That's the
base,
number one
getting
thing.
enough sleep, getting enough steps in, getting sunlight in, getting, just that, like that's supporting your metabolism rather than what these drugs do that just suppress your natural production of how your hormones are regulating. Because that's truly what's happening. Your body is getting manipulated by your brain is getting manipulated. Your brain is like so I took red true time. I had my nice normal bowl. It was, I had a little bit of spinach. I had some shrimp. I think I had some eggs, beef too. Very micronutриents. And dude, I had like 3 bites and I was done. I was tapped out. And I was so fatigued, I couldn't even function. And so, like, that was my personal experience. And the thing is, though, is that I wasn't like, yes, I had body fat to lose in a healthy amount for sure. Like, I'm not obviously, I mean, I'm all right. I'm probably sitting around like 12, 13 right now. I did Dex out at 14. So that's, fine for just moving around. But dude, I probably took that and I probably dropped. I know it sounds significant, but probably 2 to 3%. Like, dude, my underwear went down. Like, I could feel like how loose they were just from a week of using it. Like, I dropped weight like strength went down, obviously. There's no energy coming in. I think for an athlete, it's one of probably the worst things you could be doing. I'd rather have you take secretagogues to improve visceral or decrease body fat than taking a GLP. I'd rather have you do just yohimbine. I mean, just basic stuff, dude. Better than and do some lipolysis. And if you really want to increase GLP, there's so many natural ways to do it. Prebiotic fibers, Akkermansia probiotics. It's not pseudo, it's the real deal. Because what happens now is that nobody knows the long-term effects that these will cause for people. No one knows what this is going to cause. I mean, obviously, it's causing blindness in people. It's causing gastroparesis, which is a serious condition, may I add, that I know people close to me that were born with gastroparesis. It is a terrible condition to have. It is complete slowdown of your digestion. The stuff that you ate yesterday would still be digesting. Well, that's normal, but really still be digesting today. And you don't want that, dude. Any medication you take, any supplement you take, you have just slowed down the absorption and assimilation of that supplement, of that nutrient, of that food you just ate. I think for sure it's better than phentermine. It's better than the medication phentermine to lose weight because now you're not, basically just frying out your central nervous system. But I think for the most part, it just kind of like artificially overrides your natural systems, obviously what it's made to do, but it just causes a plethora of issues long term, I believe. I believe medicinally for from 8 to 6 week stints, micro dosages with using functional modalities like functional medicine, nutrition, even athlete strategies, they can be beneficial for the right client, maybe a lifestyle client to deal with a condition for sure. Like if I have someone coming in, they're 6.2 A1C, they're diabetic, 6.5 A1C. Yes, I will jump to that in conjunction with a whole restoration program. Um, but if I have someone coming in and their A1C is fine, but their hormones are imbalanced, they can't lose belly fat, and their stress is through the roof, then no, because that's just going to mask the symptom. It's still going to mask what's actually happening on the physiological level. You can't lose body fat because your stress is are so sky high and your hormones are flatlined. So that's kind of my take on it, and it's a little bit different than we look at peptides a whole. Because I have clients come to me now, and they're like, "Dude, I just want to get on peptides." They're like, "I just want to get like." I have women come to me, they're like, "I just want to get on peptides," and I'm like, "No, no, you're not, because dude, I can't do that. Just because we can access them doesn't mean that you no." And so what I've seen a lot too with it nowadays is that everyone wants the shortcut. They want the shortcut. They want what is something that I could take and then magically just I'm a different person. That's what we want as society. And I can agree with that, but it does not it's not going to be long-term success. I mean, it's not going to be long-term success. And so, I'm curious for you though. I want to ask you some questions too, like in terms of like like in my ideology, I honestly wouldn't suggest slowing down digestion even more or causing more gastric distress during the final weeks of prep. But obviously, Nick Walker, I'm seeing a lot of these other bodybuilders, they're using it. I mean, they got the mad scientists that I learned from for prescribe it, whatever. So I'm kind of curious. I'm like, what are your thoughts on that, or what's your take?
Yeah, I think this year alone was where Ozempic, Ready to try to have shot up crazy in the industry.
You know why?
Well,
So politically, they told the FDA, middle finger, like don't mess with the peptides. not only compounded pharmacies are able to get peptides because now you're able to get peptides all over the internet, and all through the different markets. So that's how it's been more accessible, because they try to put a ban on it. So that's a whole different topic. I think peptides, there's some regenerative peptides that are absolutely life-saving. Like I had a woman with terrible shoulder injury, chiropractic care, like spending $1,000 after 2 rounds of TB 500, BPC 157, eradicated. She was like, oh, she was like crying. She called me. She was crying on the phone because she finally got a solid night's of sleep because she wasn't in shoulder pain anymore. And if you walked into a chiropractor, I asked the chiropractor, I'm like, what's your thoughts on that? She's like, fake. I'm like, what?
Let me
I'm like, all
crack you
right,
real quick.
whatever. Yeah, yeah. So yeah, keep going. My bad. I cut you off.
But no. So just gotta dive into that. Obviously, peptides have some certain peptides have been here for a while.
Hmm.
Obviously in sports and not even just bodybuilding. Basketball, football, baseball. TB 500 and BPC 157 have been around for a long time.
Yeah.
I, and like I said, I'm not a healthcare profession. I'm not, licensed to, give advice this and that. But I've used it myself for
Hmm.
shoulder injuries, and this is the one thing I didn't know about in the beginning was that it's systemic, not local, so you don't have to, whatever the case
Yeah.
is.
Site. Yeah.
So I believe in those ones at a reasonable amount, and obviously in terms of specific longevity, in terms of like how long you're taking it for, I do support those, especially on needs of like, let's say you want to avoid surgery, this, and that. But for the other peptides that have been popping out, like Ozempic, Retatrutide, I just for myself, in terms of just like my ethics as a coach, I wouldn't prescribe or I wouldn't and no recommend because, like I said, it's like putting Band-Aid on a wound.
Hmm.
If you can't get to that, this is my standards too.
Yeah. I love
Prep
that.
prep in itself or going on stage is a test of your will, your strength, mental, physical, spiritual. Like it should be something that you go through and you'll learn yourself and see you can actually do it. you
Hmm.
know. And obviously, I do have certain athletes that are enhanced, and that's just another ballpark. That's
Yeah.
they're trying to go long term, they're trying to turn pros, whatever the case is. But
Yeah.
that's
It's
not that's not
goals.
that's not for everyone.
Hmm.
So prep in itself, if someone asks me when they want to go on ready to try it, Ozempic, I'm just like, you can't do it. What's wrong? Like, you know what I mean? Do you need the help? Like, you can't control yourself. You know what I mean? Because at the end of the day, that stage is a you versus you battle.
Hmm. Hmm.
Because I always like to say this to only 5% of people in this world can actually go through a prep and finish it.
Wow. Yeah, I
So a
believe
lot,
that.
a lot, a lot of people will give up halfway. They're like, "Oh shit! Like this is more intense than I thought." They see like the final package on stage, but no one sees the 16 weeks, the 12 weeks, the 20 weeks. They don't see how much it takes just to get on that one stage for one day for 30 seconds. You know what I mean?
Dude, yeah, I can't even imagine.
So for me, whenever that topic comes up, like peptides, this and that, to me, it's just the health side of my work, of my profession, is just like I don't want to do this to you, and I don't want you to go through any type of health adverse effects just because you want to go on stage. Like I'm sorry, like
Hmm.
either you do this the right way, we take a longer process to get there, which is going to be healthier for you long term, so you don't have to go on HRT, or don't do it.
Yeah,
There's no
absolutely.
excuse. There's no excuse for it. Like it's a marathon, not a race, and that's always something I like to epitomize or kind of just like stamp on anyone that I work with is you do it or you don't. That's it.
Yeah, that's huge. I mean, it's very true though too, because like a part of I think the whole prep, and I can't speak because I haven't done prep, and I know athletes might be watching this. They've done preps, they've crushed it with you as their coach and all that. But it's probably I'm assuming if I took it from where I'm seeing it at that outside view, like that's a part of it is going through the hard times. I mean, I only know about it because I've done severe cuts as a natural. My last one was last year. I dropped down to about like, it was like 7 or 6 as a natural. So, kind of low, maybe probably could have got lower for sure. But also trying to grow a business running, but like I was trying to be Superman, but it was a good time though. I learned a lot. I learned a lot though. I learned a lot. I learned that your mind is accessory. Okay, so like I learned that just like, even during growing the business, like, dude, that's a temple. You get a mental fortitude that you cannot, because yeah, for sure, you can take GLPs. Like, dude, you're not gonna be hungry. You can go through prep just fine. I'll be honest. That's what I was thinking about when I took it. I was like, oh shoot, like I'll be like you really can't. And yeah, that was a big sacrifice for me because that then means that I can't compete naturally, because I took that.
Hmm.
So like with that kind of being said too, like you it just isn't the same because I there's some bodybuilders here that I train with, and he does really well with himself. He's in the federation of, the natural. He's like a 6'7" dude. He's huge. And some other people here, we train at Los Campeones. It's a, that gym. But and like we talk about it a lot too, and it's just like, for me, everyone comes to me because, I know a lot about the science and shit, and they're like, yo, Diego, what do you think? What do you think? And I'm like, dude, there's so many other tools out there that will probably do more than just that. Like, dude, if you need like there's so many other variables that would pull the trigger more than just taking a GLP and not eating. Because you want to get that fullness, you want to get some sodium in, you want to get the carbohydrates in. And if you aren't getting that in or whatever, because you just and this is on the other side of things, just completely suppressing your appetite. Because that's what most do during prep. Because like the more so like the microdose only works because you're still eating, you're still doing well. But when you get to like the 5 milligrams a week, dude, you're shot. You're not even thinking about food. Even adhering to probably your protocols are probably just terrible. Pumps are shit. You're not getting a pre-lift meals because you can't even eat it.
Yeah.
So like that's a big issue I see all the time too, as well.
Yeah, and the biggest thing too is like every single coach is so different, like in their approach. Some, and I've heard a lot of horror stories through preps. And I'm not saying I'm perfect because I'm far from being perfect. Like, I'm still a student in the game. I'm still learning everyone. Like, I'll say this too: every single person that I prep, everyone's so different.
Yeah.
Their intake, their protocol, their rest. It's so. To me, it's like I love that pressure because then I'm learning their body. I'm only strengthening my knowledge at the same time. And I've
Mm,
known a lot of coaches out here that straight up do cookie cutter programs to copy paste, do this, do that. Yeah, sure, they
mm,
get good success, but a lot of times it doesn't, and it catches on. And it's just kind of like the harsh reality of the sport. And that's where people have to figure out, like, are you the right coach? Are you the right teacher for that student? Are you the proper student for the teacher? So I think that's also, to answer your question more specific, a lot of it is based on the client and coach
mm.
dynamic. Like, are you guys willing to try it? Are you guys willing to do this, do that? Oh, it's working. Let's try it. For me, I stick to my basic and my grounds. Like,
Yeah.
if it works, don't change it. And for me, like, obviously you have to catch up with new approach, new ways, this and that, because everything's always changing. But for me, when it comes to like medication and like protocol gear, PEDs, there's a certain baseline and there's a certain threshold that I will reach, and then I'm like, all right, this is enough. You know,
Yeah, for
I
sure.
I I go for the. This is the one thing when my coaches taught me was less is more. Less will
Mm.
always be more. The more you try to manipulate your body, the more you try to force it to change, the more you try to add so much drugs into your body, your body will actually fight back, and you will hit a
Well,
fat wall, a fat plateau, and then now you're thinking to yourself, "Oh, I need to do more," which is what a lot of athletes are doing today's generation, today's time, and then I don't know if you follow too much bodybuilding or this and that, but a lot of pro athletes are passing away.
dude,
There's a lot, like
yeah.
literally. I'm not even rest in peace, for their souls, but at least once a month or once a week, I see a post RIP athlete, and I'm just like, wow, like what's going on, man? Like 10 years ago, this wasn't happening as concurrent as now. You know what I mean? So,
Really? Wow. Yeah, I mean,
yeah.
I'm not into the sport like that, but I mean, that's tragic. I mean, and like, who's to blame? I don't know. What happened? I don't know. And you never really know unless you look at, the autopsy, but
And also,
it's
also just the other aspect too is people are not being or they're not paying attention to the potency and the purity of stuff. Like they're like, oh,
Oh,
I can get this for this price. Oh, they have a BOGO. I'm like, come on, man. Like this is the one statement I always tell all my athletes and people I work with. If you have a Ferrari, you do not want cheap gas in there.
mm-hmm.
You either you do it the right way, spend the money to get the stuff you need for your body to progress and to excel,
Yes.
or you put trash shit in your body and good luck in the future. You know, like
Yeah.
if a lot of people will just be like, "Oh, hey man, you want this? I got it online for this much." I'm like, what kind of bathtub bathroom scientist
Yeah,
made that for you? You know what I mean? Like
exactly.
to me,
Well, dude,
it's
shit's crooked. I mean, you have to, I mean, dude, it's it's not good. It's not good, especially nowadays. Dude, it's even worse. And so, like, you really got to pay attention about that too, because most of them carry lipopolysaccharides,
yeah.
LPSs. So that's bacteria that you can just shoot into yourself, which is
Right. Cross
whatever.
contamination, how it's being, to me, I just find it appalling that people are just taking risks buying things online, which, there are some reputable brands which I can can call for, but
Hmm.
majority of the stuff, if you get a good source and it's legit, spend the money. Just you're gonna thank yourself. Either spend the money to do it right, or you're gonna spend thousands later on in the hospital. Just you
Dude,
know, do your,
yeah.
do yourself a favor and stop messing with black market stuff. Like, that's only from my opinion. I'm not gonna tell anyone to stop doing what they're doing, but health is wealth. This is a marathon, not a race.
Yeah, absolutely. And dude, take it from someone like me, dude. Like, I deal with so many clients that have been through the ringer. I see your clientele. I don't know what it is in totality, but I'm assuming they're a little bit, they're hungry. I mean, like me, they're younger, maybe they're hungry. They want to do anything and everything they can to be the best that they can ever be, financially, physically, emotionally, mentally, spiritually. And when you get in that race, you become so narrow-minded that you negate everything, your future, your freaking health, man, like your health. And so what then happens is that you're just shoving your body full of anything, you're taking anything, you're doing everything, you're doing anything. And so that's why it's so valuable to have a coach because like going back to what I just said, like my clients have came to me and they've tried so many different things. They've done so many different things for their body. They've taken phentermine, they've taken Adderall, they've taken metformin, they've taken all different, they've done a lot of, they've done a lot of different things to subside what was the true reason of why you wanted this. It's like numbing the pain. That's still a symptom. It's
Mhm.
still a symptom. Like you're still doing things to numb something that going on. And so I see a lot of people that have been through the ringer, a lot of ex-athletes. I've helped a lot of people, for whatever reason, whatever thing. And so it's just something that I'm with you on that like you need to take care of yourself no matter what's going on right now in your life. You've got to take care of yourself. No matter if you're, 18-year-old and you're trying to just get in your first show, put on some muscle, get on stage. If you're a 26-year-old, you're doing whatever to, be the best you can, wherever you're at in life, take care of yourself. Get your blood work done. Listen to your coach. Get things done. And honestly, I always attest to my clients. I want them to get full medical evaluation every year, once a year, even twice a year. I want my clients to get troponin testing, which they look at the doctor looks at them and they don't even know what that is. That's testing to learn like where the heart is and structure and if there's damage. I want them to get echocardiograms. I want my clients to get stress tests. Dude, that's why I want to open I'm about to get a clinic. I want to get my own clinic. I want to do medical evaluations with a real, well, I shouldn't say real because I'd say I'm all right, but like a physician assistant or NP,
Yeah.
something like that, so we can do those. We'll draw blood too, and we'll have, all different things. It's gonna be sick, and I'm gonna get you out here to do it, and I gotta go
Oh,
out
hell
there
yeah.
too.
Yeah, we
But
got a
yeah,
big future ahead, man. You know my plans,
yeah,
so.
yeah, yeah.
Um,
So, but no, like, yeah, dude, like, man, the thing is you don't know until you lose it. You don't know until it happens. Just like those people you're talking about, the horrific events that are happening, you don't know until it happens. So be preventative, not reactive, and that's all I'm about is be preventative, not reactive.
Exactly.
You like, yeah, take care of yourself, get your blood work done. What people, how resistant people they are to get their blood work done. It's just like I don't know, but yeah,
Oh, it's too expensive. I'm like, come on, man. Nothing's too expensive for your health.
bro, what do you mean it's too expensive? Like you're gonna whatever, but that's a different one.
But yeah, Diego, that's pretty much all the questions I got for today, man. If you have
Yeah,
any
of
last minute
course.
questions that you got for me while I'm here, I'm like, I think
Yeah.
you said, I'm like the first prep coach you've had in here, so
Yeah, I mean, yeah,
take
dude,
it away,
like
man.
your work is incredible. And I think what you need to tell my audience is, and you have put people on, you have pushed people to the 1%. You have brought people to the best outcomes. You have brought best athletes. So if you're watching this replay and you're coming from my audience, understand that Kelvin has brought people at the highest level of where the body's potential can possibly be, meaning the most fat loss, the most muscle growth, and then adding in all the technical posing too as well. Looking at body composition wise and everything. I want you to explain when you are trying to get to that, because some clients do have that goal. They want to get to that, feeling peeled and shredded, but not, to the extent of the whole prep. Tell them the invaluable things that need to happen are rather just like the mental fortitude that needs to occur for you to get there and how a coach cannot push you to be there. You need to do that yourself.
Oh, for sure. And, I like to always say this, that we're not miracle workers. The
Mhm.
things that we've done to athletes and, clients, that's years of work, practice, and constant trial and errors. Kind of like what Diego does. Like, it's all about trial and errors, like learning and being a student. The one thing I will always tell anyone that I work with, whether it's competition or lifestyle, before you even think about starting your process, your journey, your goals, you need to get rid of the things that are stopping you from getting there. This is the one thing that I'm not gonna name any names right now, but let's say athlete or client one, client A, whatever, comes up to me like, hey, I want to get lean, I want to get shredded. I'm like, cool, I'll give you a plan. I'll set up like the blueprints. Is your job to follow it, but you can't do things at an 80% um, consistency. It has to be 100% day in, day out. Obviously, when it comes to lifestyle or things like, let's say, just weight loss, you want to look lean. Yes, you have some variables you can play on. You can,
Mhm.
go 5, 6 days of straight, go one day, just kind of reset, kind of like feel like you're human again, not following a diet, this and that. But you also got to remember one thing: one day won't hurt you, multiple days will. And that's one
Mhm.
thing that I always tell all my clients and athletes, like, how come I didn't look like this? How come I didn't? Okay, well, did you go out last week? Did you drink last week? Like, did you go do your cardio?
Yeah.
Did you sleep well? Like,
Look
a
at
lot
you.
of,
Look at
yeah,
you.
exactly. Like, there's a lot of times people are like, oh, things aren't changing, things aren't moving, things aren't going down. I'm like, okay, well, are you following to the T? Are you cheating? Like, you got to be realistic with yourself. Like, set expectations for yourself. Like, and also talking and communicating with your coach or whatever the case is. For me, like here's an example for me. I know a lot of coaches do once a week check-ins, which is kind of like the norm, right?
Mhm.
I don't do that. My check-ins are daily. Like,
Mhm.
people input their weight on a daily basis, and
Mhm.
when people miss
Well,
their
dude, you need to. You're at a high level, man. Like
yeah,
it's a little strategic. I'm not gonna lie. You gotta keep keeping the variables in favor.
exactly. So let's say, for example, like they don't do their check-ins and stuff like that. I will actually text them right away, like, hey, check in. I don't care. I have X amount of athletes and clients. I treat
Mhm.
everyone and I look at every single detail to the T. That's
Mhm.
what separates me sometimes because I'm more proactive than doing once a week check-ins. Because the way I
Mhm.
see is, I know this for a fact, because when I was training with my coach, I would do once a week check-ins. Let's say the check-ins are on Monday, whatever the case is. I would fuck around from Monday to Friday, and then on Saturday, Sunday lock in, so that it
Mhm.
translates well for Monday. And it's kind of like just that where, all right, well, if you're working with a coach that does once a week check-ins, you're like, well, he's not going to check on me until Monday. That means I have so many variables I can do and kind of just like, not follow it to the T. that doesn't go for everyone. And I'm not speaking for everyone. I know some people are
Of
on top of it,
course,
this and that, but
of course.
there's some accountability that individuals have to hold themselves accountable for. That just because you're working with a really good coach that have transformed hundreds of people, put people on stage, doesn't mean you can do that too. Like every single individual is different, like their genetics, what their work ethics are, this and that, their mindset. Everyone's different. But the one thing I will always say from the beginning is if you really want it, you got to do it. Like you can't
Mm,
half-ass this. Like if you really want that body, you want that goal, you want that dream, you want that stage, whatever the case is, you got to go 100%.
yeah,
It's
absolutely.
it's kind of like that 10,000 hour rule.
Hmm.
Like I don't know if you know the 10,000 hour rule. Like
Yeah, to be great.
yeah, to be great or like even be good at something like learning a piano or like an instrument, whatever
Yeah.
the case. Same thing. Put in the effort same day for the next X amount of weeks that you got to do it for.
Mm,
And I guarantee you'll see more progress doing it that way, or than trying to just kick yourself in the ass of, oh man, I messed up yesterday. I need to do more. And here's
yeah.
also the number one thing that I see that people have a misconception on is that if you mess up one day, you got to do more the next day. No, it doesn't work like that. If you
Mm,
mess up one day, just get back to it. Don't try to change
yeah.
it. Don't try to manipulate it. Just because you miss your cardio one day, you got to do 2 hours the next day. Like, no, it doesn't work like that. You can't
Mm.
catch up from the day you missed. That's gone. You got to move forward now.
Yeah, keep going.
So,
Yeah, I love that. I mean, yeah, that's an ideology that I think I really ascribe to too, because I always say process over progress. Did you follow the process to get the progress? Because the process is set in place, and so yeah, it's a little bit similar, a little bit different, but I can totally feel for that for sure.
yeah. So, it's simple. It's simple than
Mhm.
most people try to think it is, or harder than it is. Sorry.
Well, the industry tries to prey on them. Not, I don't even think it's really coaches, but the whole industry in whole. I mean, all the ads out there, all the other avenues you can go instead of actually hiring a coach. They're trying to make it, I mean, obviously with today's in AI and everything, I mean, they're trying to make it less and less about human and more about, I guess, computer. And honestly, you can't have that. I know the power of having a mentor. I have several mentors, several coaches. I always have them, but that's just, my specific situation. Not everyone needs that, but it is valuable to have that, I will
Oh,
say.
100%. I will always, this is the one thing I always say is be a sponge, absorb as much as you can, be a student. It doesn't matter if you're one of the greatest. MJ had a coach, Kobe had a coach, and,
Oh yeah,
you know,
the best coach. Yeah.
yeah, exactly. So, like, every coach has a coach, and you got to be a student in the game to keep progressing. And the second you think you know everything in life, that's when you fail. I'm
Yeah.
sorry, but I agree. That's going to be something that I will always
Well, I would
kind of
say,
like,
I mean, I tell my clients, I say, what is it? I say the most open-minded wins.
hmm
Or I might say something else, but I think, yeah, I say the most open-minded wins. That's in
for sure.
anything, not even just in health.
hmm
Like if you can take everything and formulate it to yourself into what you and your paradigm might be, then you truly are a winner. You
Oh,
truly are a killer out
100%.
there.
100%. Exactly.
Yeah, absolutely. Absolutely. Well, I want to say, so for my audience that are rewatching this, Calvin, where can they find you at?
Oh, on Instagram, just KEL
Instagram?
underscore JY. And
There
then
you go.
if you guys are listening to my athletes, client, and like my viewers, Diego's an amazing person. Please reach out to him. He can help you with your gut health, get you to where you need to be. Okay.
Awesome. Well, yeah, yeah. I mean, if you guys want my stuff, it's just Diego Reyes Health, all one word, all lowercase. And yeah, Kelvin, I really appreciate you having me on, questioning me. I love it so much. So
Yeah.
thank you
Thank
for
you for
that.
taking the time to come out here too, man. It was amazing. So
Of
we'll
course.
definitely do this
All
more.
right, brother. All right, y'all. We'll catch you soon. Give me a follow, and we'll talk
All
soon. See ya.
right, Diego. Later, man.